Hey folks, Nick the Nurse here. Today we're going to be talking about nursing diagnoses that relate to the nursing problem of cardiac tamponade. Okay? Again, remember when you have a patient who has cardiac tamponade, you have a patient who has excessive fluid accumulation around the heart. It's not letting the heart expand and contract like it needs to in order to get oxygenated blood out to the other parts of the body, as well as getting the deoxygenated blood back to the heart so that it can circulate and get all the oxygen that it needs and get rid of waste. Anyway, that's cardiac tamponade. What we need to focus on are some of the nursing diagnoses. So if you think about it for a minute. And again, I've said in other videos, when you're looking at nursing diagnoses and care plans, try to get inside the mind of the patient or how they're feeling, what they might be thinking. These are things that will frequently come up with relation to nursing diagnoses and care plans. Number one, decreased cardiac output is a nursing diagnosis that you might associate or affiliate with cardiac tamponade. Why? Because if there's excess fluid that's accumulating around the heart, your heart is going to have a hard time with its workload, and it's not going to be able to pump blood and pump up blood throughout the rest of the body, right? Right. So also you might have ineffective tissue perfusion, both within the heart and around the body itself. You might have acute pain. We talked about that when we talked about nursing interventions. We want to make sure that we treat that pain, but provide a plan to help the patient address that pain. Whether it is giving them analgesics, whether it is giving them something non-pharmacological intervention such as deep breathing or meditating, stuff like that. Also, we want to assess for risk of injury. What kind of injury are we talking about? Perhaps death or injury to the tissue or cardiac muscle. If the patient has cardiac tamponade, if they have bad tissue perfusion, that also might include brain perfusion. I suppose if it really got bad, I guess that's a stretch, but they might be at risk for falls due to the pain, perhaps confusion. So we want to look out for a risk for injury. And they also might be anxious. I don't know about you, but if I had blood that was accumulating in the sac around my heart and my heart wasn't able to beat right, I'd probably be a little bit anxious, don't you think? I bet you probably would too. So we want to help the patient develop a plan of care that addresses that nursing diagnosis of anxiety. So again, those are some of the nursing diagnoses that are associated with a patient who has cardiac tamponade. My name is Nick the Nurse. You can check out my other nursing videos at www.nickthenurse.com or check my YouTube channel out at Nick the Nurse on YouTube. And we'll see you next time.